Many months after Hurricane Katrina barreled through and the levees protecting New Orleans gave way, the images remain as shocking as ever.
It was just an unreal situation, worse than Camille.
Oh, we were up to 9 feet of water at our place, lost the house, and everything's gone there.
The memories and the continuing upheaval of those who lived through it are as painful as ever.
I'm 2.5 years old. Please, Father. My name is Jamari Scott.
They just don't care. That's all. Like everything was just taken away from me.
I don't sleep. My nerves are terrible.
We really thought there was a chance that we could rebuild our lives within a couple of months, and we all burned out horribly.
Have you seen a doctor since Katrina?
No, I haven't.
When it was over, only 3 of the 21 acute care hospitals in the New Orleans area were operating. Several have since reopened, but with limited services. Charity and university hospitals, which serve the working poor and the uninsured, New Orleans' most vulnerable, remain closed, as do most of the parish's 140 public clinics.
What Katrina destroyed was just the entire the medical delivery system in the region, not only for the uninsured but for the insured as well.
It looks like our emergency backup is gone now.
It's really a fragile situation because as the uninsured grow and the facilities are not able to keep up with that demand, so it's a house of cards right now.
Once we get the results, I'll come back.
This is what has taken the place of university and charity, a makeshift clinic serving 4,000 people a month, people in search of the most basic needs.
What happened to all your doctors?
I don't know what happened to them. I couldn't get in contact with them. I still don't know.
I'm wondering if I could get me some nerve medicine.
Because you don't have any doctor now who will prescribe that?
That's right. I can't find the doctor. I'm looking for one.
Many doctors fled and will not return, especially the specialists. Dr. James Aiken runs this clinic.
We certainly cannot also fall back on or bring in our consulting colleagues, the cardiologists, the neurologists, even general surgery, to confirm that yes, this is an appendicitis. Let's take them to the OR down the hall. That we cannot do. And so for that, there is a huge gap in what we do.
Michelle Singleton, self-employed as a tow truck driver and uninsured, was a savvy health consumer before Katrina. She knew what days a dermatologist would be on duty at Charity to treat her severe eczema. She knew when a gynecologist would be there.
It seems like you would still be a person who would know how to work a system.
Yeah.
After Katrina.
But this is a totally different system now. It is. It is.
Michelle has not seen a doctor since Katrina and suspects she has developed urinary problems. She has essentially dropped out of the system. She doesn't have the time.
People don't realize New Orleans is not up and functioning as a city. I'm talking about the inner city part of New Orleans. At 6 o'clock, everything is dark, And then if you work a full day, you get off, you're trying to find, okay, they say they give free medical service here or they doing this here. If you don't make it before that door is closed, okay, another day starts and I'm still needing health care.
70 miles away is Baton Rouge, where Linda Henderson fled with the grandson she is raising. She lost her support system, 12 brothers and sisters now scattered across the region. She lost her home. She lost her job. And then, like so many others, she lost her employer-provided health insurance.
I went to pick up my prescription and it wasn't covered anymore. Mm-hmm.
And that's when you found out?
Yes.
Linda has diabetes, arthritis, chronic sinus infections, and no means to buy the medicine she needs. She applied for Medicaid but hasn't been accepted into the program. She applied for free medications at a local clinic, but the waiting list is long.
If you were to go into the pharmacy with a prescription, what would that cost you?
It would cost me at least about $30, $40.
For a month's supply?
For a month's supply, yes.
And that's out of reach?
Oh, yes.
And what about a doctor? No doctor since September.
No doctor.
That's the one that says that you got the information.
Sheila Webb is a nurse and the former health director of New Orleans Parish. She's working to patch the gaping holes in health care for those who fled the city. She shows up one day a week at this FEMA trailer park in Baton Rouge to provide very basic care, and she tries to identify doctors who will treat the more complicated cases. But it's hard to find already stretched-thin physicians willing to take on uninsured or Medicaid patients. The toughest part, she says, has been finding OBGYNs.
We exhausted, our resources in terms of the telephone book, in terms of, calling every place that we could possibly call to get a pregnant woman referred. And that was really, really very difficult. We just could not find anyone who would take someone, even someone who actually had initiated prenatal care, and that prenatal care was interrupted by the storm.
Because my heart had been enlarged because of the medication I wasn't taking.
54-year-old Dawn Ponticakis, who was on Medicaid, knows the struggle to find care in a strange city.
Are you alone here?
Yes.
No relatives, no friends?
No.
Did you have a support system in New Orleans? Family around you, friends who
Yeah.
would help out?
Mm-hmm.
That must make it so much more difficult.
Yeah. It does.
Everything is difficult. Connecting with a physician willing to write her prescriptions, coping with declining physical and mental health, navigating a city with little public transportation.
You must be scared.
I'm scared every day. I'm scared every day.
Only recently did she find a primary care physician after she rode her bike several miles to Baton Rouge General, fearing all along she was having a heart attack.
After all this time, I found a doctor, and Dr. Wagner, and she's at Baton Rouge General, and if it wasn't for them, because I was feeling sick, I was feeling really bad, and my legs were swelling up like this, and I couldn't even hardly stand on my feet.
Luck is measured by degrees among the survivors of Katrina. Susan Finnemore, who is HIV positive and on Medicare and Medicaid, was something of a nomad in the days following Katrina, without her medications or her doctors. Now Susan is actually healthier than before the hurricane. A friend in New Orleans offered her a spare bed, which gave her the stability to reconnect with her infectious disease doctor.
I don't quit. I may get aggravated. I might give up for a few minutes. I might sit down and say, oh, to hell with it, or I wish I was dead. I might as well die. I say stuff like that, but I don't mean it. I just get so mad. I say it, it just comes out. But I'm a fighter. I've always been.
That is the attitude of health officials as well, now planning how to rebuild a system so undermined.
As tragic as this whole event has been, if we don't look for opportunities to make changes in the wake of this, then we've missed a great opportunity.
But there are so many unknowns, such as how many people will return to rebuild and whether enough doctors and nurses will return to support the population. It's a challenge just to know where to start.
What do you do first? Do you do the schools? Do you address housing? Do you have a healthcare infrastructure?
Many thousands of people are waiting for those questions to be answered.
I miss New Orleans very much, because I've been there for many years, and I'm afraid if I go back, things aren't going to be the same.
After Katrina, nothing will be the same.